Welcome to a CCIM demonstration of a client's journey through hospital and community services. Using a clinical scenario for a mock client, Mr. Joe Snyder, we will demonstrate how the common assessment information available in IAR can be used to support client care. The scenario is taken from the perspective of two clinicians, one from the hospital and one from the community. The demonstration shows how they use IAR to view timely assessment information to better understand their client's health status and enable collaborative care planning. So let's get started with the scenario. My name is Sally, and I'm a mental health case manager. Joe is referred to my community mental health organization in May 2016. As part of the assessment process, I review information about Joe that was collected by other healthcare providers. IAR allows me to view assessments that will inform my work with Joe. I check to see if Joe has any assessments on IAR by entering his name and date of birth. Joe's name comes up. On the timeline, I see that Joe has one assessment, the CMH, used in inpatient mental health services. It was completed on May 2, 2016. So I know that Joe was recently hospitalized for mental health reasons. I open it up, and I review it to gain an understanding of Joe's condition to inform his service plan for case management. I jump to section CC to find out why he was admitted to hospital. Under reasons for admission, I learn that Joe was a threat or danger to himself. To learn more about this, I go to the summary, as this focuses on risk factors to be aware of for Joe. Section D, harm to self or others, shows that Joe had a past self-injury attempt more than a year ago. Precipitating this recent hospitalization, Joe had intent to injure himself, his family and friends expressed concerns, and he had formulated a plan to end his life. With this information, I know that part of my work with Joe is to develop a crisis plan that documents the actions Joe would take to get help if he experiences thoughts of suicide while in the community. I go back to the detailed assessment, and I take a look at section G, self-care. Joe is assessed as requiring supervision with personal hygiene, extensive assistance with meal preparation, and supervision with managing finances. As a case manager, I can work with Joe to build skills in these areas. Now I have a better understanding of Joe and the support he requires. I then complete the OCAN with Joe and upload it to IAR. I work with Joe in the case management program, and he is able to live successfully in the community from May to December 2016. I later complete a 6-month OCAN reassessment with Joe in December 2016. Then Joe has a relapse and is hospitalized again. This time I was able to support Joe in getting to the hospital because he followed his agreed-upon crisis plan and contacted me when he was feeling suicidal. A couple of days later, the inpatient social worker, Mohammed, contacted me.
My name is Mohammed, and I'll be working with Joe while he's in the hospital. I use IAR because it provides me quick access to information collected by healthcare providers working with Joe in the community. I look up Joe using his health card number. I see that Joe has 2 OCANs completed. I immediately know that he has been receiving community mental health services. I take a look at the list of assessments, and I want to review the most recent OCAN, which is a reassessment completed in December 2016. I go to the detailed view. I want to find out what services Joe has accessed, so I go to the Mental Health Functional Center Use section. I see that Joe has been involved in a few types of community mental health services. Joe has been receiving case management services since June 14th, 2016. And I see the contact information for his case manager, Sally. I give Sally a call and arrange for her to meet with me and Joe at the hospital to discuss the kind of support he requires once discharged. I take a look at the section on the access to family doctor. I learn that Joe has a family doctor, but he hasn't been seen for over a year. Joe needs to have more regular contact with primary health care, and this will be part of the discharge plan. Joe has been hospitalized as a result of increased symptoms of depression, including thoughts of suicide. So I focus in on 2 domains to understand his needs and the level of support he's received: psychological distress and safety to self. I review the information in the psychological distress domain. For question 1, both Joe and his case manager, Sally, rated psychological distress as an unmet need, indicating that it is a serious problem for Joe. For question 2, Joe was getting no support from family and friends. For question 3A, Joe was receiving some support from services at a low level of help. For question 3B, it shows that Joe requires help from services at a moderate level, so it was identified that Joe needs a higher level of support than he's currently getting. Comments explained that Joe was experiencing symptoms of depression. He was feeling more down, difficult to get out of bed, crying, and lack of motivation. As an action, Sally agreed to accompany Joe to his psychiatrist appointment. Under the safety to self domain, both Joe and his case manager rated this issue as an unmet need. Similar to the psychological distress domain, the responses to question 3 indicate that Joe required a higher level of support than he was getting. Joe reported that he recently had suicidal thoughts. He reported not having a plan to harm himself. He agreed to tell his psychiatrist about this. Sally and Joe reviewed his crisis plan to agree on actions to take if thoughts of self-harm escalate. I jump to the summary of actions section. This allows me to see priority domains and the actions that Joe and Sally were focused on. Safety to self and psychological distress were identified as priority areas of unmet need leading up to the hospitalization. I see that Sally accompanied Joe to his psychiatrist appointment. As a part of the discharge plan from the hospital, I will recommend that Sally continue to do this. I will also recommend that she accompany him to appointments with his family doctor. Company and intimate relationships were also identified as areas requiring support. While in the hospital, I will have conversations with Joe about his social network and actions he could take to help address these areas. For example, taking steps to connect with his daughter. This information has helped me better understand Joe's issues as I start to work with him. 5 days later, I contact Sally to let her know that Joe is being discharged from the hospital tomorrow, and an appointment is made for Sally to visit Joe in his home.
In preparation for Joe's return to the community, I log onto IAR. I see that Joe had a RI-HC done while in hospital, so I know the CCAC became involved, and I want to understand his health condition that led to CCAC involvement. I go to Section J, Disease Diagnosis. I learn that Joe has been diagnosed with congestive heart failure, with a code of 2 indicating that this condition is being monitored or treated by a home care professional. I go to Section H, Physical Functioning, and I look at the second column labeled Difficulty. I look for a code of 2 to identify the areas he is experiencing great difficulty in. These instrumental activities of daily living include meal preparation, ordinary housework, managing finances, shopping, and transportation. On the other hand, he is independent in most of the activities of daily living, self-care, such as dressing and bathing. This helps me to quickly understand his strengths and deficits. As part of my job, I will focus on helping Joe to build skills in some of these areas and link to other supports that can assist him, such as Meals on Wheels. I want to know what kind of support was put in place through the CCAC, so I go into Section P, Service Utilization. Here it indicates that Joe is receiving support from home health aides twice a week for 4 hours to assist him. I will share with Joe that I have reviewed this assessment and discussed the impact that his physical health condition may be having on his mental health. I will ask his permission to contact the CCAC so we can work collaboratively to support Joe. Thank you for watching this video. The scenario has provided you with a practical example of how common assessment information available in IAR can be used to support client care. If you have any questions or comments, contact us by email or by phone through the contact details listed here.